Hello, today I will demonstrate you the back of leg. The back of leg is also called as the flexor compartment of the leg. In this region we have the muscles arranged in two groups, the superficial group and the deep group. In the superficial group we have three muscles. One is the gastrocnemius, number two is the soleus, and we have the plantaris. And in the deep group we have four muscles. Number one is the flexor hallucis longus, flexor digitorum longus, we have the tibialis posterior, and we have the popliteus muscle. So, these muscles, and also we have the vessels and nerves like tibial nerve, the posterior tibial vessels, the peroneal vessels are seen in this compartment. So, I will demonstrate all these structures on the cadaver. Yeah, so the back of leg muscles, the superficial muscles, the first muscle is this. This is the gastrocnemius muscle. This gastrocnemius muscle will take origin from the condylus of the femur by two tendinous heads. One is, this is the medial head and this is the lateral head. The medial head is larger and it arises from the posterior part of medial condyle of the femur and also from the popliteal surface of the femur. The lateral head, it arises from a depression area on the lateral surface of the lateral condyle of the femur and also takes few fibers from the lateral epicondyle of the femur. Now, when you see this muscle insertion, this muscle, the two fleshy bellies will descend to form a fullness of the calf, and these two bellies unite to blend with the soleus to form this tendon. This is called as the tendocalcaneus, and this tendocalcaneus is inserted onto the medial thirds of posterior surface of the calcaneum, and this muscle, it is supplied by the tibial nerve, and this muscle is action is, it is a plantar flexion of the ankle joint, and also it takes part in the flexion of the knee joint. Next we have a muscle which is a plantaris, a small slender muscle. Now once I reflected this lateral head of gastrocnemius, you can see this muscle, this one. So this is a plantaris muscle, which is a small fusiform shaped muscle. It is a slender tendon which intervenes between the gastrocnemius lateral head and the soleus muscle. This is soleus muscle. So between lateral head of gastrocnemius and the soleus muscle, you see this slender muscle. It takes origin from the lower thirds of lateral supracondylar ridge, and if you see, it is inserted. The fleshy bell accompanies the lateral head. So I have cut the muscle. So this was a continuation. It was like this, yeah. So this it ends into a long tendon, which is a slender tendon, passes between the gastrocnemius and soleus and blends with the medial margin of the tendocalcaneum. And this muscle, it is innervated by the tibial nerve, and action is, it is a plantar flexion of the foot. Now this muscle is the soleus muscle. The soleus muscle, it is a multipinnate muscle. It is shaped like a sole of the foot, and if you see the origin of this, it has got an horseshoe shape origin. You can see this horseshoe shape origin. It takes origin from the posterior surface of the head of the fibula. It also takes origin from the soleal line of the tibia, and also it takes origin from the tendinous arch between the tibia and the fibula. And insertion of this muscle, it is a bulk muscle which slopes downwards and continues with the tendocalcaneum and inserted onto the middle thirds of posterior surface of the calcaneum. And this muscle is also again innervated by the tibial nerve, and action of this is, it is a plantar flexion of the foot. And this soleus muscle, it has got a peculiarity, it has got a characteristic feature, like this muscle, it is pierced by perforating veins, contains rich plexus of small veins, and contraction of this muscle will squeeze the venous blood, and thus it acts as a peripheral heart. So this muscle, I have cut the soleus muscle in its middle, reflected, this one. So you can see some small venous plexus within the substance of this muscle. So these are the three muscles which are included in the superficial group of the flexor compartment or the back of leg. So gastrocnemius as reflected, then this is the plantaris, and this is the soleus. So these three muscles, when I have reflected this, you can see this is the strongest tendon of the body, which is the tendocalcaneum. Next we have the deeper muscles. The deeper muscles here, this muscle, this is the popliteus muscle. This popliteus muscle, it is a triangular, it is triangular, okay, forms the floor of the popliteus, and this muscle, it takes origin from the intracapsular, arises as a tendon from the anterior part of the lateral surface of lateral condyle of the femur, and insertion of this, it is a fleshy part inserted to the triangular area on the posterior surface of the tibia above the soleal line, and this muscle is again innervated by the tibial nerve, and action of this popliteus muscle is it initiates the flexion of the knee joint, and also it is taking part in unlocking of the knee joints. Next we move on to the flexor digitorum longus, this muscle, this one. This is the flexor digitorum longus. This flexor digitorum longus muscle, it takes origin from the posterior surface of the tibia below the soleal line, and also few fibers takes origin from the fibula also. And insertion of this muscle, it is a bipinnate muscle. It crosses the tendon of tibialis posterior. Yes, this is a tendon of tibialis posterior. So it crosses the tibialis posterior tendon. It crosses the tibialis posterior tendon, and the tendon splits into 4 slips for the lateral 4 toes, and it also receives the tendons of the flexor digitorum accessoris and get inserted onto the plantar surface of the bases of terminal phalanx for the lateral 4 toes. And not only that, from these tendons you can see the lumbrical muscles will take origin. This muscle is again innervated by the tibial nerve, and action is it is a plantar flexion of the lateral 4 toes. This is flexor digitorum longus. Next we have this muscle, this one. This is the flexor hallucis longus. Flexor hallucis longus, it takes origin from the posterior surface of the fibula, from the medial crest and interosseous membrane, and this muscle is inserted, this is a bipinnate muscle again, and it is inserted onto the base of the distal phalanx of the great toe, and this muscle is innervated by tibial nerve, and action is it is a plantar flexion of the great toe and acts as the plantar flexion of the ankle joint as well, and this also maintains the medial longitudinal arch. So this one, so this tendon, this is the flexor hallucis longus muscle. Next we have tibia. Deeper muscle is this. When I reflect this, you can see this deep muscle. Yeah, this one. This is the tibialis posterior. This tibialis posterior is a deep flexor muscle of the calf, intervenes between the flexor digitorum longus and flexor hallucis longus, and origin, it takes origin from the posterior surface of the shaft of the tibia below the soleal line. It also takes origin from the shaft of the fibula from its posterior surface. Insertion, if you see, this is again a bipinnate muscle, crosses superficially by the flexor digitorum longus tendon. Yes, is it not crossing? Yes. So this is tibialis posterior. It is crossed by superficially by this flexor digitorum longus tendon and inserted onto the tuberosity of the navicular bone. It is inserted onto this tendon. It is inserted onto the tuberosity of the navicular bone and plantar surface of all tarsal bones except talus and the base of the first metatarsal bone. And this muscle is again, it is innervated by the tibial nerve, and action of this is, it is inverter of the foot. It maintains medial longitudinal arch, plantar flexor of the foot at the ankle joint. So this is the tibialis posterior. Apart from the muscle, you have this one. This is the posterior tibial vessel, artery, and this one is a tibial nerve. So I have a quick recap of all these muscles. So we have the gastrocnemius muscle. Then we have, this is the plantaris muscle, this is the soleus muscle. All these together they form the tendocalcaneum. And the deeper plane we have the first here, this is the triangular muscle, which is the popliteus muscle. Then we have this one, flexor digitorum longus. Then this is the flexor hallucis longus. In between we have this muscle, this is tibialis posterior. And the vessels, you can see, this is the posterior tibial vessels and this is the tibial nerve. These are all the muscles, vessels you see in the posterior compartment or the back of leg. Thank you.